So there's this concept that I was thinking about, and I am going to completely credit this one to a person that I spoke to at the market that I went to a few weeks ago, the Manic Pixie market. And he's like, "You're like a little scientist." And I'm like, "Yeah, when it comes to my body, I am." So I experiment a lot with diets, especially, and with herbs because of how many issues I've had with medications and with diets prescribed by doctors, especially because they might know one condition or another condition, but the combination of conditions makes it difficult for them to have a thing. They can give you things to try, but when they give you definitives, I have learned that those are doctors I don't want to work with. Doctors that believe that there is a definitive one size fits all are not doctors I want to work with. Doctors who do not admit that the different combinations can affect people differently are doctors I don't want to work with. People who don't admit that the baselines for blood work and testing and diagnosing are not correct for women, especially, but also for people of color and different race and origins. I don't know how to say that without sounding racist. So you know what I mean. People not non-white people. Okay, so all of that testing and the testing criteria and the baselines and everything are made for those people, then that affects my ability to trust any doctor that fully relies on that instead of their intelligence. Now, with that said, with that scientific mind, not all of us that did not get the COVID vaccine are non-vaxxers. And this is a big one that I had with my neurologist that made me stop seeing that neurologist, even though in everything else in his practice as a neurologist, he was pretty spot on. His note taking was a problem because neurologists after him have not been able to pick up where he left off, and that's terrifying to me. However, his treatment and involving me in my treatment plan and decision making in my treatment plan made our ability to try out different medications, because it's not a one size fits all. It's very difficult to find the right combination for migraines, especially if you're still being exposed to your triggers. It's very difficult to find treatment plans and things that continue to work after they've already stopped working. Okay, so it's very important that you keep that in mind when I say what I'm going to say, because I stopped seeing him for his commentary around the COVID vaccine when I refused to get it. And he called me ignorant, and I didn't even argue. I was like, okay, that's the end of our over decade relationship, because you had all these records of how I did follow instruction and how I wasn't sick in the head when it came to getting medical treatment, that I actually sought medical treatment each time my condition was worsening. And that commentary alone was enough for me to stop seeking migraine treatments for over 5 years. And they have escalated to the point where not even my CBD is working after taking that 6+ month break of not using CBD. So just keep that in mind. Some of us who decided not to get vaccines decided because when you have autoimmune disorders, two major things can happen. I'm not saying it's the only things, I'm saying two major things can happen, and this is not medical advice, and you shouldn't base your decisions on your body based on what I'm about to say. You need to do your own research, and you need to know your own body. When I would because I have an overactive immune system that was attacking my kidneys, I was placed on long-term medications, chemotherapy, and steroid medications and stuff like that. So when antibiotics started giving me things like colitis, yes, the wrong antibiotics can give you colitis and other forms of intestinal infections and intestinal problems that can cause psychiatric or what looks like psychiatric problems. So if the people around you are ill-informed and refuse to learn with you, they will be left way behind because they don't want to learn to understand these concepts. So they won't be able to spot when you're having a difficulty and you need assistance because of those antibiotics. And so because of that starting to happen and them knowing that they were going to keep me on these medications long term, what they did was they put me on an antibiotic that is like, I don't remember what they're called, but basically it's not the same as the regular amoxicillin Cepro thing. It's completely, I can't remember the name of it, but anyways, and I was on that for years to prevent severe infections because I easily caught infections. I didn't get urinary tract infections. No, I got it in the kidney. By the time we noticed it in the bladder, the kidneys were starting to lose function again. So they kept me on this antibiotic. Then they started giving me vaccines to try to prevent things like the flu and pneumonia. Except I started getting the flu consistently with the flu vaccines because my overactive immune system would attack the vaccination site. It would get super swollen. I wouldn't be able to use my arms for weeks at a time. And I would be hospitalized. And throughout the years, it would get worse and worse and worse. I believe it was 2013 or 14 that I spent most of the year in the hospital because of these different problems with my gut. Because the antibiotics would fuck with my gut, which would cause all these other symptoms. They would send me to psychiatry instead of acknowledging these symptoms were happening. And there's emails to prove it. I emailed the doctors telling them all these things were happening. And all because there wasn't proper documentation for my inflammatory responses and my responses to medication. It wasn't ignorance that made me not want to get the COVID vaccine, because I also confirmed that I would get pneumonia every time I would have to get the pneumonia vaccine, and it almost killed me when ER doctors ignored me until about my 4th or 5th visit to the emergency room, where I insisted on an x-ray and I was diagnosed with walking pneumonia. So just keep that in mind, that a lot of our fear and medical trauma comes from real places and from real experiences. And just because you aren't the medical professional that caused it, it does not mean that you are not responsible for the aftermath of what is happening to your patient, because you won't be able to help them if you want them to get help for their medical trauma before they get help for their conditions that are causing a lot of those psychiatric and anxiety disorders and depression that you guys are diagnosing as psychiatric problems and not medical problems needing medical intervention. It's why a lot of dementia, Alzheimer's, and Parkinson's patients die, because they're unable to communicate what they're feeling inside. And it's so frustrating, because even when I was a caregiver, I'd insist and I'd get on the nurses' nerves because I'd noticed these subtle signs and no one would hear me when I was telling them. And it's like, dude, I know, because I get like this. Like, I wish you guys would hear me, but I didn't even want to admit that I was experiencing a lot of these things because I didn't want to continue to be accused of having psychiatric problems I didn't have. Because the psychiatric medications for the psychiatric problems that I didn't have created other problems, very severe problems that broke me. It broke my ability to care for myself. And after years of being gaslit, I can honestly tell you, you guys have to stop judging everybody who says no to the flu, COVID, and pneumonia vaccines the same as people who are completely non-vaxxers. There's a huge difference. Okay? I'm not saying that some of us aren't wrong for not wanting those vaccines if we are constantly getting those things, but I haven't been hospitalized for a flu since I stopped getting the vaccine. After I was taken off of chemotherapy, there was no reason to keep me on those vaccines. And if you look at the chart progression, because I would love my chart to be used for these studies. I would love to teach you guys about this shit because I noticed the patterns, but no one wants to fucking listen to me. But if you use my chart, you can see, yes, the vaccine was warranted while I was on those prednisone, cyclophosphamide, cyclosporin, I can't remember. There was a bunch of chemotherapies and steroids. While I was on those, yes, the flu vaccine and pneumonia vaccine were very well warranted. But because I have an overactive immune system, the moment that I was no longer taking immunosuppressants, you actually created a storm in my body and actually created the inflammatory responses that were causing a lot of the neurological problems, sinus problems, eye problems, ear problems, stomach problems, mouth problems, throat problems. If you guys do not take proper notes, some of us are literally trying to work with you by showing up to our appointments to get these things documented. So in the future, other people can be helped by this new way of documenting things and keeping track of these diseases. So when the medical health organizations see a pattern and they're like, oh shit, maybe it's this that's causing it, they can take all of those notes and see the pattern arise throughout those charts, because they weren't being dismissed as psychiatric problems, and further investigation, which was warranted, was done. And a lot of the medical costs that come from having unmanaged people with chronic illness disappears, because management becomes easier when the problem hasn't become exponential and multi-system problem. I started with one problem that you guys created into a multi-system problem because you refused to hear me when I was telling you. While I still had Dr. Bieberstein, who was constantly fighting and advocating and putting these specialists, keeping them on their fucking toes, and my primary care, Dr. Boyd, if she still works for Kaiser Permanente, talk to her about fixing what you have done. Because Kaiser used to be okay. You guys ruined it for a lot of people. You ruined Kaiser for a lot of people. But even when I volunteered for the experimentation on my kidneys, knowing that it could cause more harm than good, and you guys were paying for it through MFAP, the fact that you warranted the assistance of MFAP while you were experimenting on me, but did not warrant assisting the people after they get off these medications, because you know that it's going to damage their quality of life and their ability to work as they detox and get all these medications out of themselves. The fact that there was no care provided for that is where you went wrong. You went wrong. Every person who goes through chemotherapy needs a full-on detox, slow full-on detox after they stop these medications, because of how much impact they will have on their bodies. Once they are detoxed, you can see where that person is still deficit in those problems, and then you can address them. And that's why I said I completely understood why you weren't taking me seriously until I reduced and took myself off the THC and CBD. But even then, I'm going to your doctors and you're still acting a fool. Instead of being honest with me and telling me what you are doing, you're trying to do it all under wraps and behind the thing because you fear retaliation. Accountability is not retaliation. My record proves that I have tried to work with these insurances, that I'm not for retaliation if it's going to harm my health and my mental health and my stress, because I know that stress makes me very, very ill, and I mean deathly ill. You've almost killed me several times by exposing me to the levels of stress that you have exposed me to in the past 3 years. For no goddamn reason other than the fact that you refuse to take responsibility for the aftermath of a lot of these experimental treatments. And like I said, when I was fully informed, and there was full informed consent in those experiments, I was a willing participant. The moment you started deciding what information to give me and what information not to give me, that's when you created an unwilling participant in their own care. And you can call it learned helplessness all you want, but it's forced helplessness. It's forced hopelessness that treatment or treatment options will ever exist for conditions like ours, even though we as a community have figured out diets, have figured out techniques, have figured out ways of living to be able to improve these things. And instead of getting support from grants and places to grow this exponentially and take some of that burden off of healthcare, were pointed as crazy people and depicted as psychotic crazy people, so that our credibility and our story does not matter to the general public, because we have already been harmfully depicted as people who are crazy and who are lying, when in fact we were not lying. They were trying to take away our credibility so that Big Pharma didn't have to take accountability for the way they're educating their doctors. Because it's still Big Pharma's fault that their doctors aren't being educated properly. Or it's intentional. You either have to repair it, or you have to admit that it's intentional harm. You have to work towards reparation, or you have to take accountability and responsibility for the intentional harm. It's that simple. You don't get to have it both ways, and you do not get to gaslight patients. How many crazy people have you created that did not exist solely on that purpose and that fact? Let's get real. Let's get real, because you guys want us to take responsibility and accountability for every single thing in our lives, and I'm all for it. I have done that, and it has changed my life. You are correct. It has completely changed my life. I will no longer let people convince me that I was things that I was not, solely because they refused to take accountability to what they were doing to my body, because they did not have proper testing documentation or information given to the patient. And that's not on me. That's not on me, because I was a willing patient for so many years. I was the epitome of a good patient. But nurses be always complaining that patients be attacking them and they don't get paid enough for that, right? But then they don't take seriously the patient who stays calm, stays centered, even though they're in excruciating pain, who tries not to cry too much, because if you cry too much, they think you're being dramatic and blah, 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 blah. You take those patients for granted. And because you take them for granted, later on, they're that patient who comes in desperate from being ignored for so long that now they are the patient that's attacking you. They are not hostile. You created that hostility. And the fact that you don't rat your fellow nurses off and your fellow doctors out for doing that shit is on you too. So you don't get to enable and then say, I didn't do it, so why am I being attacked? You don't get to do that. No doctor or nurse gets to do that if you didn't report the ones who are doing that. Not treating people's pain because they have trauma is abuse and medical neglect. Period. Point blank. Not treating people's pain because one doctor decided that they were a substance abuser when they were not. They were, there's many reasons why a person can be labeled a substance abuse person, and suicide is a really big one. A lot of them in the process of suicide get labeled that way. When you need help, you get labeled and cut out of getting any of the help that you are going to need. So yeah, we learn to live with our pain, and our pain causes lasting marks on our body, autoimmune disorders, dysfunctions like dysautonomia, and other forms of dysfunctions within our body, both sensory and neurologically, all because you're telling us to ignore our pain that you don't want to treat because you decided the patient is not responsible enough, even though they were well treated on this medication. But you decided, I want to put them on this medication, even though they were well treated on this one. And that one wasn't working well, so they were looking for this, and then they started taking more of this, trying to get the relief that they got from this. So now they're the addict because they took too much of this when they were telling you that this wasn't working. And that's on my record too. And that is on my record too, when tramadol started giving me severe side effects. So take responsibility and accountability as medical professionals, or stop diminishing and destroying patients' lives because you are irresponsible human beings who took your hierarchical position and you took advantage of your position as medical professionals. You took advantage of our trust in you as medical professionals, and you destroyed our ability to trust in our own bodies, and then called us psychotic and needing of psychiatric help. All of you motherfuckers need psychiatric help. All of you do. And the only way the DEA can fix the big fuck up that they created with opioids is by holding these medical professionals accountable the ones who are now refusing to treat patients because of your laws, but also holding big pharma accountable for this bullshit because they have as much to do with it as the others. So don't try to play like one or the other. It's a whole systematic problem. And let's not pretend it isn't. I love you and have a beautiful day.